Hi, this is Dr. David Wages here at North Shore Plastic Surgery and Med Spa, and today I wanted to demonstrate how I do fillers around the area of the mouth. And most people, when they want fillers in this area, the first thing they'll say is, I don't want those ugly lips that I see on TV. I just want to look natural and just a little bit smooth and plump and kind of get rid of some of the other wrinkles. And that's exactly the perfect type of person who I like to see in my office, somebody who has realistic expectations. So this is a young woman who is in her mid-40s, and what we're going to be doing today is putting some filler into these lines around the mouth and then just a little bit into the lip itself. The people who usually put fillers in, they usually have multiple injections, which can be quite painful, causing bruising and bleeding, and that's uncomfortable for the patient and a mess for the doctor. So I don't do it that way. The way I'm going to do it today is a technique where I make a tiny little access puncture here, and then this is what's called a cannula. So it's blunt, so it can't cut, and I feed it through that little puncture wound, and then I can put it underneath the skin into this area and over here. And by doing it that way, this just glides through the tissue and doesn't cause any pain or bleeding. And because of that, the patient's able to enjoy the results right away without any discomfort. And it just takes a couple minutes. So we've already talked to this patient about what she wants to do, and so we're just going to go ahead and do the treatment now. Just a little tiny pinch here. This is the worst part, just the first little pinch.
So cannula is kind of like a straw, Dr. Wages? Like it's hollow?
It is a hollow tube, and then it's got an opening, and I don't know if you can see that, but I'm just going to squeeze a little bit out of the opening, and it kind of comes out on the side port, and you'll see it kind of just gently, see how that little glob comes out?
Yes.
And then that's how it goes in. So by doing it that way, you're not going to damage a blood vessel. There's less risk of you injecting it into a blood vessel or somewhere that you don't want it to be.
And what filler are you using today?
So this is Juvederm Ultra Plus, and so it has numbing medicine already mixed in it. So once it goes in, the area will be comfortable, and the numbing lasts about 45 minutes and goes away, but she's not going to have any downtime today.
Why do you prefer to use a cannula?
Because less pain, almost zero bruising, and it's quick and easy. And so I'm just going to put this right in here, and I can actually feel where that's going. So I know exactly where it's going to be. I'm going to put a little material in here.
So those are called marionette lines that you're filling?
Yes, ma'am.
And you use your other finger, like you feather it in?
I'll feather it in, just kind of, I can fill it in here, and I can tell where I'm putting it. So I'm putting it exactly where I want it, and I'm looking at how much I'm putting into these areas, and you know, I've done this enough that thousands of times that it's pretty easy for me to know where to put it and how much to get the result. You know, some people aren't exactly symmetric, so you don't always put the same amount in each location.
Does it hurt at all? I'm asking the patient.
No.
So if you could look at her lips, if this were hurting, she'd be grimacing. And so she doesn't feel any of this. This is great.
How long does that filler last, Dr. Wages?
So this filler, I love it because it lasts about a year. And the last time Kristen had a treatment was about a year ago. So now we're fitting it right over here into the lip. And so she's not flinching at all. She's not feeling this at all.
And it makes such a dramatic impact, I think. You can see, just looking at her face, the difference on the side you're working on versus her left side. It's a deeper line. And you're putting it in the lip area now to smooth those lines out? Yep.
Just feather that right there. I'm going to go down here to the lower lip and just going to feed that right around the corner.
And you said that treatment will last you for about a year.
Yeah.
Wonderful.
So 9 to 12 months. I think the longest I've ever seen this product last in the patient is about 18 months. But most people, it's about a year.
Well, we call it your method of doing it the Wages way here at North Shore Plastic Surgery and Med Spa. And I thank you for taking the time to show us the Wages way of doing fillers. Have a great day, Dr. Wages.
All right, thank you.